Universal health coverage is affordable health care for everyone, everywhere, every time, whenever they need it. It means that people don't have to die needlessly because they cannot afford health care or it's not available for them when they need it. And this is quite personal for me. In 2012, I lost my dad. He had been battling with congenital heart disease for a couple of years, and he had to undergo 2 major surgeries to fix the valves in his heart. That was one of the most devastating periods in my life because the surgery wasn't cheap. And for my family, it was probably one of the most difficult things we had to do. It was an emergency, he collapsed at home. And the closest hospital that we could go to that was closest from home, we got there, they didn't even allow us enter. They turned us back at the gate because they said we're not registered at the hospital. So they can't even attend to him, no emergency, or else we would have to start the registration process all over. This was somebody that had collapsed at home, and we brought him to the nearest hospital close to us. But we didn't even make it past the gate of that hospital. Eventually, we had to just go to the general hospital where he usually takes or gets his treatment. He didn't make it to the general hospital. For a country that is blessed with so much human potential, human resources, you start to wonder if we really do care about our people as we should. There are 1,000 more people out there who really cannot speak for themselves, who really don't even have the means to talk about this, to talk about their pain, to even share it with somebody else. And every day people die needlessly, deaths that can be prevented. And one of the ways that we can actually prevent this needless deaths by ensuring that everybody, everywhere has equal rights to access to healthcare. It doesn't matter where they live, it doesn't matter who they are, it doesn't matter what their political or cultural or religious affiliations are. The government needs to pay more attention and put health in that first position where it should have. Make it a priority. Beyond speaking of, it really needs to be a priority. Then our hospitals have to work, our primary healthcare centers have to work. They need to be fully equipped. I want to see in Nigeria where nobody dies from preventable causes. Nobody dies because they cannot afford the healthcare that they deserve. This is why I push for universal health coverage. My name is Celestina Obiekea, and I am a universal health coverage advocate.